Thank you so much. My name is Temesi Ochola. I am a warrior, sickle cell warrior, and I'm excited that I finished, first of all, the 3 days conference of NCD, and I've been part of it, and my takeaway is on this: eye care. Eye care. The strategy of eye care, if it's horizontally done in all NCDs, it will create an impact. Let me just take you. You're wondering what does eye care mean? Huh? Eye care is a strategy that was done in diabetes, but if it's done, for example, in sickle cell, that means our doctors, the people who are HP, the healthcare providers, the community workers, the community health workers, if they build capacity, their capacity is built. That's for C, capacity building for these people. Yeah, if you have modules for doctors, clinicians, and nurses on sickle cell disease and the management, then we'll move a step higher in regards to sickle cell awareness. Second is the availability of care. If it's taken, because I know people in villages, in slums, who are suffering from sickle cell, but when they imagine going to hospital, and they imagine the hectic of just going to hospital, the line, the queue, and you're in pain. So some resort to stay at home or to go to a traditional medicine. But if these things are available and they are near to them, I assure you, this will be a game changer. The other one is reach. R is for reach, and if you can reach through awareness, through awareness, if you can make awareness, if you can go like NCD now, we come together and we do an horizontal awareness whereby we look at the common factor. What is the common factor that affecting all the NCDs? Is it mental health? Is it pain, which is common? And we do awareness of NCD. We'll reach a lot of people and we'll make NCD be something that is known to the policymaker. And finally, is the empowerment. This conference was part of my empowerment. We got empowered through this conference. If we do lots of this empowerment, not only for doctors, but also to the caregivers and the warriors themselves, NCD warriors, it means that we'll live long, we'll live a healthy life, but more so, we'll live knowing how to control the NCD that is affecting us. So I'm glad to be here. And support by reaching out, support by liking, support by subscribing, but more so support by funding. Asanteni.